Relations between patients and caregivers. Module content. Module outcomes. Aim of the module. Some historical data on the importance of interpersonal relations between patients and caregivers. The importance of interpersonal relations. Module outcomes. At the end of the module, patients and their families can understand the importance of interpersonal relationships. This module aims to warn you of the importance of personal relationships between patients and healthcare professionals. Some historical data on the importance of interpersonal relations between patients and caregivers. Lisa Brookman and Leonard Syme in 1979. Followed about 7,000 individuals over 9 years to identify facts contributing to their longevity or premature death. People without social and community ties were more likely to die from all investigated causes over the study period, compared to those who cultivated or maintained social relationships. Some historical data on the importance of interpersonal relations between patients and caregivers. Important study on social relations and health was published in the 1980s. House, Landis and Umberson. Higher risk of death among people with a small amount of interpersonal relationships and, sometimes, low-quality social relationships. Both humans and animals have indicated that social isolation is one of the main factors of mortality. The importance of interpersonal relations. The essence of nursing, of being a caregiver, is caring, and it needs to be efficient and rendered in a humanized way. It involves biopsychosocial, spiritual and affective needs and is directly related to the communication process between the caregiver-patient. Heavy checkmark. Nursing care goes beyond the technique, procedure, being expressed by attitudes, in addition to being relational. Heavy checkmark. When care takes place in an environment that requires high technicality, the treatment can become mechanical due to the high complexity of equipment. However, the person in care still needs to be listened and needs to empathize with the other being. The importance of interpersonal relations. The hospitalization process brings several disorders to the patient and his family, so the nurse must use strategies aimed at interacting with the client family through attitudes of sensitivity, acceptance, and empathy. The communication is essential for quality care. Distant emotional involvement is considered a negative factor, however, it becomes a positive factor when the distanced relationship is reversed, bringing the client and family closer to the health team. It's important to address the need to humanize nursing care for patients and care for their family members. The communication process is necessary and must be efficient, be it verbal or nonverbal. The importance of interpersonal relations. The caregiver suffers from the tension experienced in the environment, and it is almost certain that each professional reacts in different ways when assisting the severely ill patient, and, again, the lack of emotional involvement presents itself as a limiting factor in the caregiver-patient-family interrelationship. Communication is the fundamental instrument for interaction between the health team and the patient when it is noticeable. It is through communication that interrelationship takes place, easing the feelings of anguish experienced by the hospitalized person, increasing their confidence and self-esteem. Communication is a positive point that permeates the interaction between caregiver-patient and that can become therapeutic. It was proved to be the major positive factor in the relationship between the nursing team, family, and patients, standing out as an interlocutor of the interaction process between them.